Hello, everybody. Jon Thompson here from Community.Connect, coming at you live with another interview from a key stakeholder in our work. Dr. Ben Thrower is the director of the MS Institute at the Shepherd Center here in Atlanta, Georgia. Also a board member of Community.Connect, and another example of how we are striving to bring to you, our community, news and information from the field, people who are practitioners here in the United States, as well as in our partner communities around Nicaragua, the Dominican Republic, and Costa Rica. So Ben, thank you for giving us some time today. I know you're incredibly busy. What can you tell us about the state of affairs in your community and there at Shepherd? What's going on?
Hey, John, thank you for having me, and I hope you're healthy, and I hope everyone listening in is healthy as well. So it's certainly an interesting time right now, and it's really quite unprecedented. So for Shepherd Center, we work with multiple sclerosis, traumatic brain injury, spinal cord injury. The way we are taking care of people has drastically changed. Obviously, for our inpatient services, which is mainly spinal cord injury and traumatic brain injury, those services have really carried on because those are individuals who just, they have to be here. For multiple sclerosis, most of what we do is on an outpatient basis. And so we have really had to look at who we can treat by telemedicine at home and keep them as safe as possible, and then who really has to come in here. Most of our patients that are still coming in are on IV medications that they just have to have. So we're doing a lot of screening 24 hours before each person comes in by telephone. We have screening then in person once people show up, really looking for any of those high risk sort of patients. And then we do have individuals who unfortunately have COVID or are highly suspected of having COVID that still have to come in and get their infusions. So we are having those patients. We're meeting them at the car with one of our nurses in full protective gear. We put the patient in full protective gear, unless the caregiver who has come with them absolutely has to come in the building. We're trying to have them stay out in the car to really minimize the exposure of our staff of who are coming in. So it really has drastically changed the way we're taking care of people.
And I imagine that's playing out, throughout the country and the world as health centers, hospitals, and clinics try to maintain their connection with patients. What have you seen? I mean, how long do you think this is going to last? That's the increase. I know it's a golden question, right? I mean, what do you see?
Yeah, that's the hard one. I mean, listening to all of the experts, we have some folks that I know from the CDC who I stay in contact with. I mean, I don't think we've hit our peak. Here we are on April 1st. I think we're going to probably see the peak in about 2 weeks. The tail end of that, the cases may drag on though for weeks after that. So we may be into July, or even later, that we're still seeing some cases. I think a lot of the unknowns are, so once we start relaxing some of the social distancing and letting people go back to work and whatnot, are we going to see a second bump? Are we going to see, because we've certainly seen it in other countries. Hopefully that's not going to be as significant as the peak that we're going to likely see in the United States in 2 weeks, but it's certainly possible. I think it's exciting that we are making some big strides. I don't think we're going to have the vaccine for probably a year or so, but some of the treatments that are out there are looking very promising. Some of the things like hydroxychloroquine and azithromycin, that maybe if we start those sooner than later, we'll really cut down on the viral replication. And those are just widely available drugs, and they're already FDA approved. They have a known safety profile. So I think we're very hopeful that that's going to pan out in a big way.
No doubt. And I know we can learn from the experience, in China and Italy and Spain. As of today, Georgia has 4,117 cases and 125 deaths. And, we're bracing ourselves for those numbers to rise. Hopefully this won't last. through the summer. We're bracing ourselves for a wave that we just don't know how big it's going to be, and that's disconcerting, particularly for our friends in Latin America and the Caribbean. I know in Nicaragua there are people who are caring for loved ones who may have a special need. They may need to go see their doctor on a regular basis. Our Together for Health program provides a continuum of care for 20 special needs patients in a rural community called Los Robles. You're very familiar with that community. What kind of advice could we provide our friends and partners there as they get ready for this oncoming wave?
Yeah, my hope is that a community like Los Robles, because it is more isolated and maybe less densely populated, that maybe things that the COVID-19 won't hit as hard there. It's hard to know what the absolute numbers of COVID cases are in Nicaragua and the DR. It's hard to know really in any country, because we know there are a lot of young asymptomatic individuals who are going around who feel fine, who unfortunately are so capable of spreading the virus to other people and potentially infecting people who are not going to be asymptomatic, who maybe a more vulnerable population. So I think as much as we can, the social distancing. I think the recommendations we have here, in the United States, would apply anywhere, but obviously maybe more difficult in a country with less resources. But as much as we can, the social distancing. I don't know what the situation is, in our two countries that we work in for hand wipes and disinfectants, but we can use local resources to make our own disinfectants. So there's a great recipe for a disinfectant for hard surfaces. It's just a third cup of bleach to water. So that is for any hard surface, with a washcloth, a rag, a paper towel, you can wipe down any hard surface and just let it sit there. So third cup of bleach to one gallon of water is going to kill coronavirus and just about anything else out there. You probably are not going to want to use that as a disinfectant for your hands. So that's going to be a little bit harsh on your hands. So if people have access to rubbing alcohol, so if someone has diabetes and they're doing an injection, the same alcohol that we use as a rubbing alcohol could be used to make a hand sanitizer. You'd love to find an alcohol that is 90% or more. And so what you're trying to do is put together something that's going to end up with 60 to 70% alcohol at the end of the day. And so if we can do that, then you're going to mix it with a little bit of aloe vera gel. So it's going to be, and I've got the recipe here. I have to put my glasses on. I want to make sure I get the recipe right. It is 1 cup of the rubbing alcohol to a half a cup of the aloe vera gel. So it's a 1 cup alcohol, half cup aloe vera. Some people are adding essential oils just to make it smell good. I think that's icing on the cake. If you can do it, great. But you really just want something that's going to kill that, the COVID, the coronavirus. And then just good old fashioned soap and water. If you don't, we get so focused on hand wipes and other things like that, but soap and water still kills coronavirus. And so 20 seconds of really vigorous hand washing is going to also kill the coronavirus. So really it comes down to the 3 things. It's keeping your hands clean and keeping your hands away from your face, cleaning hard surfaces as much as you can in the home, and then the social distancing.
Yeah, during the time of social distancing, we've found that in many ways our community is coming together even stronger. A lot of solidarity has been born out of these times of distress, and we see how that's playing out in communities like Los Robles, where our staff can't get to the families that rely on us for food and medicine and projects, etc. But people in the community are stepping up to take care of neighbors, to take care of family and friends. And what we're able to do is just try to channel some of those resources, like education and like information, where it may be challenging for them to get really good sources of accurate information. So I want to respect your time. I'm so thankful that people like you are out there working on the front lines of this and other health issues like multiple sclerosis. And I think there's a, um, I don't know, I think we're going to come out of this with an even greater appreciation for respiratory therapists and those practitioners that, you know, deal with some of society's most challenging problems. And as we, as the general society, you know, freak out and get spun and just try to figure out how to move forward, you and your colleagues are the ones that are there where the rubber meets the road. And just really thankful for who you are and what you're doing, Ben, and your wife Karen, who's a pediatrician. I know you're doing God's work, and just wanted to thank you on behalf of our staff and the communities we support around the world.
Well, thank you very much. And you know, I think, you know, hopefully as challenging as things are right now, hopefully there'll be some silver linings at the end of this, that, you know, there will be a stronger sense of community and a stronger sense of how reliant we are on each other. You know, I think at the end of the day, there'll be some good things that will come out of this. We just need to get through the storm and get to the sunshine on the other side.
That's right. Well, a storm it is indeed. We hope we can check back in with you as things progress in the weeks and months to come. Ben, thank you again for everything, and we'll see you soon. Stay safe.
All right. Take care.
Bye-bye.